Hi, I'm Ian from Back to Life Clinic, and I thought it'd be a really useful thing for me to come online and just talk you through some of the safety precautions and procedures that we're taking to keep everybody safe. So that's our clients safe, but also the team here safe as well. So our procedures actually start, or the safety sort of systems that we do, actually start the day before the appointment that you have. So the day before, you'll receive a reminder email, and in that email there'll be a link to a screening questionnaire. So what I'm going to do is try and just show you that screening questionnaire now. It's a fairly straightforward form, and basically we're going to screen down, and the first bit is it's asking whether you've had any of the typical symptoms. So that's the continuous cough, the raised temperature, or any changes to your sense of taste or smell. So if you're happy none of those things have happened, then we'll just get you to sign in the box. So I'm just going to do a little bit there. Okay. And then the next bit is just checking that you're okay with all the sort of procedures that we're going to be doing in clinic. And so we actually, are you or any member of your household classified as vulnerable? So if we're clicking no, and then are you happy to attend? Yes. And then it's just submit. So really straightforward. And that will then tell us just before your appointment that actually, no symptoms for yourself, and that you're all clear for coming into clinic. So that's great. So the next stage is what happens when you're in clinic. So when you arrive, what we ask you to do, ideally, is to wear a face mask. So it can be one of these sort of medical ones, but basically any face mask that you can keep on through the appointment is fine. We also ask when you arrive is to sanitize your hands. So we've got a touch-free sort of sanitizer machine. So you come in, place your hands underneath, and it automatically gives you the hand sanitizer. And we're also going to check your temperature. So we have a little temperature device. It's touch-free. So we basically point it at your forehead, and it will hopefully, can you see on there, just gives you a reading. So mine's 36.0 today, so perfectly within that normal range. And so that's the things that we ask from yourself. All right, so what about us? So what are we doing? So I'm going to try and demonstrate you now the PPE equipment that we're wearing, and it's pretty extensive what we wear, but it'd be good to try and show you that now. All right, so when you come into clinic, this is what I'll be wearing. So we've got a disposable apron in here, we've got disposable gloves, we've got a face mask, we've also got the face visor. All right, so between every patient, or for every patient, basically these are removed and replaced, and we put on new PPE for the next patient. So a further thing that we do in clinic as well is also we have the window open throughout the day to make sure there's plenty of ventilation and that exchange of air within the clinic. And because it might get a little bit cold over the winter, we've also got an extra radiator. So we've bought a new radiator down here, which will keep the room at a lovely, steady 20 degrees. So hopefully it'll be nice and pleasant when you're in, but also with that lovely fresh air for everybody. So once we finish the appointment with the client, that's basically when all the cleaning starts. So between every patient that we have, the whole room is cleaned. So the room is sprayed, all white. So depending on the surface. So in here, we use these Clinal medical wipes for the surfaces. And then for any electrical equipment, so for things like the card machine that we use, we've got Clinal's alcohol wipes as well for any of that electrical gear. So anything that's been touched, so all the surface, so the tables, the chairs, the door handles, all of the cupboards, the plinth that you can see behind me, any equipment that's been used. So, for example, like all the equipment that we have now is kept in boxes. So if it's not used, the box is just cleaned. But if we use anything, every item is clean. So whether it's like the balls that we use, or any bands, anything that sort of we use with the patients or is got out, touched, is thoroughly cleaned out. So all of this cleaning and the ventilating of the room basically means that for a sort of normal half-hour appointment, it now lasts an hour for us. But from our perspective, we feel that that's the best way to make sure that we can provide the safe environment to make sure that we can give you the best treatment. So I've taken you through the sort of cleaning procedures and the ventilating that we're doing, but there's a few extra sort of measures that we do as well. So one of the main ones is hand washing. So obviously thorough sort of and regular hand washing, and we're also sort of washing down to the elbows as well. So thorough sort of arm washing really, as you would in normal sort of medical practice. Following that sort of medical practice theme, obviously all the waste that we create, that's all sort of disposed of in an appropriate way for healthcare waste. The clothes that we're wearing, so all of these get sort of washed, oil wash with disinfectant. There's separate home clothes and clinic clothes, so all the things that I wear in clinic only get used in clinic. All of the items that we have in the room are now sort of wipeable, so things like the plinth cover, all the sort of the kit that we use, the balls. So I used to use tennis balls, but obviously you can't wipe those clean. So we can't use tennis balls anymore. We're using wipeable sort of balls that we can use, massage balls that we can use with people instead in clinic. So these are just sort of some of the things that we're doing to try and create the safest, sort of cleanest environment that we can to make sure that we can keep treating you and providing you with that safe environment when you come in for treatment. So hopefully that's explained some of the things that we're doing to keep yourselves and our team sort of safe when you're coming in for treatment. But one of the questions I've had recently was from asking about what happens if we sort of move up in tiers in the sort of lockdown status. And basically what we've been told so far is that there would be no impact on us whatsoever, because we're a healthcare setting and we're operating at these sort of basically the top level of sort of cleanliness that procedures that we can. And in fact, in a Backlife clinic, we're going over and above what the sort of government requirements are for us. That there should be absolutely no reason that we need to close the clinic again if there are further sort of lockdown measures. But you never know what's going to happen in the future. We didn't know this sort of, so many months ago. But even if we do, then we still have the telehealth option, and that worked really well previously when we had to close the clinic. So hopefully, we can keep helping you and keep making sure that we're getting more and more people back to that sort of living and enjoying life again. So I hope this has been useful for you, and sort of explain some of the measures that we're taking. If you are interested in coming in for a booking, you can book online on the Back to Life website. So it's backtolifeclinic.co.uk, and just go to the booking section there. Or alternatively, you can give us a call at the clinic, and it's 01636 36 20 22. So I just look forward to hopefully helping more of you in future. Thank you.